Health savings account is a tax-advantaged bank account. It's a place where people can store money tax-free to help save for future medical expenses. The important thing to know is that only people in certain types of health plans can use a health savings account. So you have to be in a plan with a high deductible. It has to have a deductible of at least $1,300 for an individual. And the plans also have to meet a number of other requirements. The most important is probably that the plan is not allowed to help pay for any non-preventive medical care before a person has paid off their full deductible. So what that means for an everyday person is that they're on the hook for at least $1,300 of medical expenses if they have a health problem before they get any help from their insurer to afford care.
Health savings accounts work by giving the patient the power. Most of the time we see in our healthcare system that the patient has no power. They go into a doctor's that they're not paying. They go into a hospital that they aren't the payer. But a health savings account helps switch that around. It puts the money in the patient's pocket so they finally become the client. And that's not what's seen in the rest of the healthcare system. And so what we see with people that have health savings accounts is they shop more, and that means that they usually get higher quality care and they get more access to care.
The main strength of a health savings account is that it does allow people to save money tax-free, which is a huge, tax perk for people. But the real drawback is that you have to be able to afford to put money into a health savings account. And the reality for many working class families is that they don't have the financial funds to dedicate to future health expenses and to put into a health savings account. Something that's important to know is that once money goes into a health savings account, it can only be spent on healthcare expenses. If it's spent on other expenses that a family might face, they will be penalized through taxes. And for many working families living paycheck to paycheck, they can't afford to segregate off a portion of their savings just for future healthcare emergencies. Many families have an emergency fund that's for healthcare, that's for home repairs, that's for in case someone loses a job. And so what that means in practice is that health savings accounts are really just predominantly used by wealthy households. If you look at all of the money in health savings accounts right now, 70% of that money is coming from households making over $100,000. And so it's something that's not used much by working class families, largely because they do not have the financial resources to put that money aside.
Some people talk about the fact that an HSA is only for rich people, or they talk about it as only being for the wealthy, and that's the completely wrong way to view an HSA. An HSA helps change the market, so it does give the individual more power at the time of use, but that power changes the market. And so what we see is that doctors then compete for money, and they compete for that money by increasing quality and increasing access and lowering their prices. And so everybody benefits from this increased competition. Healthcare is considered this unbreakable market. It's considered to be above the consumer's ability to purchase healthcare, and that's just not paying attention to other markets, and it's not paying attention to how smart consumers are. We see when consumers are given the money, when they, even on Medicaid, there's programs that put Medicaid money up front. What we see is that patients like control, and they like control because that means that if they're getting bad service, they can purchase better insurance. It means that if they don't like the person that's serving them, they can move their money towards somebody else. And so the concern that people aren't intelligent enough to shop for care is just wrong, and we see that over and over and over again in what is considered a growing free market in healthcare where people are shopping with their health savings accounts dollars?
I think there's a misconception among conservative proponents of health savings accounts that they make people smarter healthcare consumers. You often hear them say, well, we want to make healthcare more consumer directed. Well, healthcare isn't really like other goods that people consume. Oftentimes people are using healthcare in an emergent situation where they don't have time to shop around for the best price. And more broadly, when we look at how people use care, people in health savings account qualified plans aren't smarter shoppers at all. Actually, the evidence tells us the opposite, that people are actually skimping on care that they need and they're not using care in a smarter way, quote unquote. The real issue is that they need to have the funds to put into the account, and many families don't. When you look at people in employer-sponsored coverage, sometimes their employer funds their health savings accounts, and that can help make care, financially affordable. But when you're talking about people who are purchasing coverage on their own, just having a place to store their own money isn't going to put care financially in reach. I think the other challenge is a lot of the newly insured are learning how to use health insurance for the first time right now. They're lower income families, which we know are families who are less likely to have bank accounts to really use traditional financing mechanisms. And so when you layer on top learning how to use insurance and a new type of savings account that might be completely foreign to them because they don't really use a lot of normal banking accounts right now, you really run the risk of leaving people completely confused about how to use their health plan.
When we look at changes in HSAs, there's only one direction that seems to be going now. With Republicans have the White House and majorities in both the House and Senate, and that is that HSAs are going to become more flexible. So right now there's a cap. That cap will be increased. You have to have an HSA with certain plans. The plans that you have to have that HSA with will be increased or liberalized. The uses of an HSA might be liberalized, where you can use it for paying for your insurance plan, or maybe paying for health sharing ministries. The way and the direction that we see the health savings account market going is just growing, and it's going to increase in both the flexibility and the number of people in that market, because as patients get more power, and your next door neighbor has more money that they can choose their health care with, then you become interested. And we've seen the HSA growth over the years just continue to accelerate, and we don't see that stopping anytime soon. The equalizing of the tax treatment of health insurance is important, because right now rich people are getting more money than poor people, and that just doesn't make sense under the system. So when we hear the complaint that an HSA might only work for the more wealthy, I tend to agree more than I should, or more than I would under a normal market, because under our current system, the more money you make, the more tax advantage you get in our current insurance system. The less money you make, the less your tax treatment. And so now not only are you paying for the same good, or not only are employees paying for the same good, but then this lower paid employee is getting even less money, which means that they have less of a chance to put money into their HSA. So if we equalize the tax treatment, we're taking money from the highest paid employees and bringing it back to the lower paid employees. Now they have a bigger chance to put money into their HSA, and they have a bigger ability to compete in the market.
Health savings accounts and Medicaid are a very dangerous path to go down, and the experience in Indiana has shown that they're administratively very expensive for a state to operate, and that for the most part, beneficiaries are unaware of the account, they don't know how to use it, and that really shines a light on the fact that these accounts really aren't making people smarter consumers of healthcare. They're not, influencing their healthcare decisions at all. They're really creating barriers to them understanding how to access healthcare and being able to afford the care they need. A lot of states have been moving since passage of the ACA to transform their healthcare system in other ways to improve utilization of high-value care, to decrease avoidable hospitalization, and to reduce overall spending. Moving in the directions of health savings accounts flies in the face of all of that progress and the goals of health systems transformation. When people aren't getting preventive care, when they aren't getting the chronic disease management services that they need, well, that has downstream implications for our healthcare system. And patients pay a price both in their health and financially, but our system pays a price as well. And so if we're in a system where people can't afford to manage their health and avoid the hospital, well, we're all paying higher medical costs because of that.
As a public policy matter, what we need to do is give states the flexibility to decide how they're going to take care of money. We need to give individuals as much flexibility to decide how they're going to take care of money. And then the transient populations or the in and out of the program populations kind of take care of themselves. They need help, they need focus, and if you give the chronic condition enrollees the ability to control their own money and manage their own money, it's another population that you don't have to spend as much time managing.